Hi everyone, I'm Dr. Caryn Fung. Today I would like to share with you about the importance of breastfeeding in dentistry point of view. As a new mother, we will want to give the best to our children. And I am just like you. I have a 15 months old baby and now I'm having a second one. I hope I could share with you some knowledge about the impact of breastfeeding in dentistry and as well as oral care in babies. We will cover 3 parts in this video. Dentistry in pregnancy, benefit of breastfeeding in dentistry, and lastly, baby oral care. So first, let's talk about ourselves, a pregnant mother. During the 9 months of pregnancy, one of the most worst scenario that we have every day is when we start brushing our teeth. We will have bleeding gums, we will have inflamed gums, and sometimes you feel that you have loosening of the gums. At this current situation, when we are pregnant, we are very susceptible to all kinds of infections. So if we have any kinds of toothache, even though today if we go to a dentist, what we can do is we will just give you a temporary solution to relieve the pain. And we couldn't give you a very permanent solution, example root canal, example extractions, unless you are at second trimester. So to me, it is so important that we will have to check and go for a regular dental checkup with the dentist to do scaling and cleaning in order to remove the inflammation on the gums and reduce down the bacteria that we had in the gums, so that this will make our life in the pregnant time will be much more beneficial to us. Let's move to the second part of the video. The most important of this video is we are going to talk about the benefit of breastfeeding and the development of oral facial, which is head and face, as well as the dental development during breastfeeding. So what happened in this? As you can see in the graphic here, the infant feedings takes place by the rhythmic pumping action known as suckling. In the few days after the birth, the lips are not readily pursed, but a primitive rooting reflex exists when the children is nursed. It turns its head naturally to the breast. In breastfeeding, baby pulls and sucks the nipple into the mouth. Part of the areola is held in the mouth, so the nipple is held far back at the junction of hard palate and soft palates. The lips forms a seal and the mouth cavity is enlarged as the jaw moves. The whole lower jaw is raised and lowered alternately with a rocking motion. The tongue is protruded and remains in contact with the lower lips throughout. As the jaw lowers, the body of the tongue moves downwards and forwards. Other than the physiology breastfeeding mechanism, they also found that there is an association between bottle feeding and overjet, meaning protrusion of anterior placing of the teeth of the upper jaw. Meaning, babies that are bodily fed tends to have protruded upper incisors. While breastfed baby, the risk of anterior-posterior malrelationship is lesser. Meaning, the baby which is breastfed, they have lesser dental problem in future which require orthodontics. Studies also shows that the more frequent use of pacifier, thumb sucking, was associated with shorter breastfeeding duration. Even a group of mothers which is highly motivated for breastfeeding. So you can see the babies will be thumb sucking during sleep or having a lazy muscles when they are asleep with the wide opening of mouth. So the conclusion is breastfed infants showed a little changes in maxillary arch length and palatal depth as compared to bottle-fed infants at the month of 15. Hence, breastfed babies will have better craniofacial and dental development. Now, let's come to the third part of the video, which is baby oral care. How are we supposed to clean the baby's oral cavities and how are we supposed to maintain them well from the first day of birth? So let's start with the newborns. When the baby come out first day, they do not have any teeth. They only have gum pads. So if we do not clean their gum pads every time after they latch or breastfed, so the baby couldn't drink and finally baby will form some white lesions, and this is caused by the milk and form a fungus infection. These lesions are called oral thrush. If these conditions happen, baby couldn't drink milk, and so their weight will drop, and as a parents we will start to be worried. Other than the white lesions, there are a lesion which is red color, which is called the saliva rash, which happens around the mouth. Move on to the next stage of baby development growth, which is called the teething. At the month of 3, baby start to teeth, to have teething, and it will end when all the deciduous teeth has erupted. What happens when the baby is teething? The baby will feel irritable. The baby will just grab anything and stuff them into the mouth and start to chew or start to bite. And number 3, they will have saliva drools and rashes around the mouth. Number 4, they couldn't sleep at night, and they couldn't drink milk, or they couldn't eat anything. How can we help the babies by relieve the teething problems? So number 1, what we can do is we give them a teether. So we will have to choose a good teether to the babies so that they will not add it as a pacifiers. Number 2, if the baby start to have something solid above 6 months old, what we can do is we can give them apple or even carrots. You cut them into long rectangular shapes so the baby can hold them in the palm, and you freeze this rectangular for 5 minutes. After that, when you give it to the baby, because it already hardened and already iced, so it becomes a pain relief for the babies. And number 3, do not try to put any anesthetic or numbing gel to soothe the baby. And sometimes some of the baby will have fever due to the teething problem. There's nothing much we can do as a dentist point of view. What we can do is just give them much more tender, loving care, and hopefully all these things will go away when the time comes. In Malaysia, our water system, government has put in a lot of fluoride to prevent dental caries in our society. So it is not required for us to add fluoride on the toothpaste for the babies or the children. So non-fluoridated toothpaste for the children up to 9 years old. And all the children are supposed to be supervised and supposed to be brushed again by all the parents up to 9 years old. When they already understand how to brush their teeth well, then only we let go and let them brush themselves. What happens if there is too much of fluoride in our teeth? As you can see in the pictures, it will be yellowish stain, which will affect the aesthetic view later on. So this yellowish stain or white stain that happen in the teeth will not be pretty for all the adults. Before I end this video, I would like to thank all mothers for your time, and I would like to show you a clip on how we brush a toddler teeth. Do you enjoy the video? I hope this video and this session is informative to everyone. For all mothers, have a pleasant, smooth delivery and enjoy your motherhood. Thank you very much.